My name is Maria Etienne. I'm a professor of nursing from Miami-Dade College. I am by trade a nurse educator, but I'm a nurse practitioner, pediatrics, family, and gerontology. I am the president of Miami Chapter Black Nurses Association. So it's a pleasure to be here to collaborate with everyone on the topic of disparities and, of course, why it's important for wellness screenings. And so I thought, I wanted to acknowledge Dr. Cheryl Holder, who has been our leader in this grant project. And all of the project, of course, is called Keeping the Faith to Fight COVID-19 program. It's funded by the Health Foundation of South Florida. And I really wanted to acknowledge all of the collaborating partners, the participant of all the churches, the pastors, and of course, the James Wilson Bridges Medical Society, Miami Chapter Black Nurses Association, the Haitian American Nurses Association of Florida, and of course, the Student National Medical Student Association, the FIU chapter. And so just like any presentation we do, we're gonna go over the health disparities and look at some of the underlying disparities that may be associated with the COVID-19 cases. We'll talk about the most prevalent disparities among African Americans. And I think when I do this presentation, I include Latinx, and of course, to discuss the racial inequities that exist among vulnerable and poor communities. And we want to share some updates and of course, review some of the wellness screening measures. And I thought it would be good for us to at least list 3 interventions or solutions that we can do to promote the COVID-19 vaccination. And so, what do we know about health disparities? We know health disparities is not simply a difference in health outcomes by race or ethnicity, but it is a disproportionate difference attributed to variables other than access to care. And so when we talk about disparities, I was reading a journal and this research article that talk about the reason SARS-CoV-2, which is the COVID-19 pandemic, it has affected disadvantaged Hispanics and Black African Americans population disproportionately. And its result in, based on all these disparities, we are seeing an increased rate in infection. We're also seeing the adverse outcome being reported. And now with the variant, everyone is concerned about not only disparities, but how can we do something about that? And I thought this quote by Capel, Perry, and Wagner was interesting, where it says, disparity should be viewed as a train of events leading to measurable differences in access to, utilization of, or quality care, health status, or health outcomes. And so when we look at healthy people 20, now we have healthy people 30, they define health disparities as a particular type of health differences that is closely linked with social, economic, and or environmental disadvantages. The National Institute of Health defined health disparities are differences in incidence, prevalence, mortality, and burden of diseases and other adverse health outcomes that exist among specific population groups in the United States. When we look at health disparities, we know that it has impacted several groups, but when we look at some of the greatest obstacle to health based on racial or ethnic group, we also see religion, socioeconomic status, gender, age, immigration status, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, and income levels and education level, all of those, and of course with other historical characteristics that are linked to discrimination or exclusion. And this is based from the National Institute of Minority Health and Disparities in 2020. So it's important for us to recognize the impact that social determinants have on health outcome specific populations. So when we talk about our communities, this project, Keeping the Faith to Fight COVID-19, the zip codes, if you notice that we have selected zip codes in churches that are in areas that are most vulnerable, meaning that either these individuals do not have access, or they have some types of those determinants, some of those social determinants of health that we've been discussing. So when we look at health, overall health, the World Health Organization defined health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And so, and socioeconomic barriers which may prohibit equitable access to those good health and wellness. So Healthy People 2020 stipulated that it is important for us to create social and physical environments that promote good health for all. So what does that mean to us, churches? So when we talk about to the church, we know that the church is one of the most sacred, one of the most respected temple that exists. So when people come there, they want to feel not only at peace, but they also want to feel that they're safe. So it is important for you as churches not only to reopen safely, but to ensure that your congregation is not being impacted. And so we have to adhere to some of those things that we're going to be talking about on how to promote good health. So when we talk about social determinants, we're looking at conditions in the environment where we live, where we're born, where we work, where we play, where we worship. And so it's important for us to look at those factors because it may impact quality of life outcomes. So when we look at some of the factors that influence racial and ethnic minority group, I think I've already mentioned a lot of them, but I wanted to touch on where Blacks were more likely than whites to report not being able to see a doctor in the past year because of costs. And we know that COVID-19 has added to some of those burdens. So I wanted you as churches, as lead church leaders, to really reinforce to the congregation that we know it's COVID. Please still continue to get your check. Make sure you go see your doctor to get checked. And I tell people from day one, they call me Dr. Maria Etienne, but I'm not a physician. I'm a nurse practitioner. And so oftentimes patients go see their doctors. They don't talk about how they feel. They don't talk about the way they're feeling, not only mentally or physically, and they don't ask the questions that they need to ask. So because of the distrust in healthcare system, and not to mention all the stigma and the systemic inequalities. So we need to really talk about it and make sure that folks are aware of that. So I think I've already mentioned that poor access to healthcare and healthy foods. And we have to make sure we eat healthy. Our nutrition must be, up in alignment with our state of health. And some people struggle with employment. Some people have high stress, and there's several other factors that we know that are associated with COVID. COVID happened, but we know that there were pre-existing factors, pre-existing conditions that really influence your health. So now that COVID is the pandemic happened, then we have to say, okay, what did we do before COVID, and what did we do in the midst of COVID? So we have to remind people of color that are more likely to live in the urban area and crowded families, multiple dwellings, and they're at risk to that exposure. And that is why we're saying, let's try to make sure that you try to avoid some of those. Now, this is I think I've already talked about this, but this is why health disparities exist. We've already talked about this. We've already talked about the impact. If you look at the pictures, I mean, outside of your church, we have homeless populations in South Florida, and we have a lot of other things that impact our communities. So historically, we see the history of systemic racism and inequity in access to healthcare, and it has made African American more vulnerable to the virus. Yes, we are going to continue to say it, but we have to be responsible. Black suffers the highest rate of obesity, diabetes, and asthma, which make them more susceptible and are more likely to be uninsured. So that is why when Dr. Holder asked for us to talk about disparities, these are some of the pre-existing condition that will impact you as a people. So that's why we have to talk about it. And when we talk about some folks, you know, there's so many things that we can go on and on and on, but living conditions, you know, going out in the street, going to church and not wearing a mask and you're not vaccinated, it is not cool. So what we're trying to say is these things really contributed to us as a minority people. We have to do our part. We have to make sure we wear our masks. We have to make sure we wash our hands, and we have to make sure we preach what we talk. You know what they say: we walk and talk the talk and walk, vice versa. You have to be able to talk to your individuals to let them know you do have a choice, but let's make the right choice to keep each other safe. Now, you know, I would be remiss if I didn't talk about the vulnerable populations. We know the elderly and those with the underlying conditions that I mentioned earlier, like the blood pressure, the heart problems, the diabetes, are more likely to develop the COVID-19 illness seriously. And so we need to make sure, because their immune system is already fragile, it's important for us to do everything in our power to protect them. So therefore, we have to encourage each other, you know, not only to keep each other safe, but, you know, stay well nourished, drink, increase your, you know, stay hydrated, take your vitamin D. Again, you have to talk with your doctor, make sure you take your vitamins regularly. And so it's important for us to educate our population who are at risk. And I think earlier on we had mentioned who were those people who are seriously impacted. And I'm not sure if the president of the Student National Medical Association is with us, but they did prepare their slides and I was able to put them in here. So basically, we're talking about screening tests. We're talking about the importance for having them. The goal is really to detect early diseases early so we can treat them effectively, or to reduce the risk of those diseases through a more thorough monitoring or surveillance of lifestyle changes. So what are some of those important screening that we talk about? Well, we're talking about your blood pressure. It's important to get your blood pressure checked regularly. It's important to ask your doctor to check your, not only your blood pressure, but your cholesterol levels, your blood sugar. Okay, so when we do this glucose levels, we're screening you for the diabetes. And for women, it's important to get your annual pap smears. And men, again, you know, based on your age, you know, you want to get your prostate check and all of that screening, especially if you've passed 40 and older, and if you had any history of any problems, so you want to make sure you talk. So based on your age or any other risk factors, additional screening may be available. For example, the American Cancer Society, of course, recommends that once you reach the age of 40 and older, you get your annual mammogram screening. There are some new guidelines that, you know, we need to follow when it comes to cancer. You know, once you reach 50, they say, well, did you get your colonoscopy yet? You know, did you check your colon? So, you know, a lot of people are checking them early too, especially if they have a history of cancer in their family. So that's why it's important to have good communication with your physician and practitioner. And so it's additionally for sexually active individuals, you know, we do STD screenings. These are important to detect if you have any, let's say, chlamydia, gonorrhea, or any syphilis or anything like that. And so we can start you on early treatment and to avoid serious complication in the future. More recently, COVID-19 screenings are important. So if you have not had get tested, we implore you to get tested, because you want to help protect those around you. I don't know why you would not want to know, because you need to know, because you just now know to, you know, if your mother or your grandmother or your brothers and sisters in the house and you are COVID positive and you didn't know about it, and now you just made a whole lot of people sick in the house. And then can you imagine if at least 10 people in the household have to be quarantined? No, that's not a good thing. So we want you to know, that's why we're doing COVID testing. And again, if you're not vaccinated, we encourage you to be vaccinated. So when we look at the the reason we're also doing some screenings, particularly with breasts and colorectal. Breast cancer is the second leading cause of death in the United States. And we've seen among women. And again, men also can get breast cancer, but very percentage. We've seen the literature that shows about 2% of men get breast cancer, but it is real. So colorectal screenings, particularly in the uninsured age eligible adults, are 50% less than the age eligible insured adult. So 6 out of 10 women eligible for breast, cervical, all of those screenings are not up to date. So a lot of people are using the COVID as an excuse not to go to get their screening. Folks, I'm telling you, pastors, please talk to your congregation. This is part of health. Tell them, get to their doctors and get their mammogram, get their screenings done. Because what happened is you don't want to get a late stage diagnosis. For example, we know that breast cancer occurs more frequently in white women. However, guess who dies the most with it? Black women. So that is why we're saying get tested early. And of course, the proportion is higher in women with a high school degree or less. Why? Because they're not reading, they don't understand what's going on. It's called the health literacy issue is another barrier. And so that's why a lot of people wait till the last minute. And so Black individuals with cancer are more likely than white individuals will be diagnosed with that breast cancer. And again, cervical cancer, you got to do a pap smear to make sure we detect if there's anything early, we can do early detection. Non-Hispanics, Black individuals, and Alaskan Native have the highest rate of incidence and mortality for those colorectal cancer. And so when we're looking at the standard benefits versus risk, the question here, why should I do this? And what are the risks? What are the benefits? So when we look at the risk, we see that early detection reduces mortality, not only from colorectal, but breast cancer, cervical, and lung cancer. And most of the time, that is a major benefit because of the early detection that you did. It can prevent cancers from identifying, because right away, if they identify those lesions, they can remove them before they get into a higher stage. Right? Because you have some folks who get diagnosed with prostate cancer late stage because they did not get that annual, they didn't get their prostate check by their physician or the nurse practitioner. Risk, again, when we look at the risk, okay, what can happen to me if I do this screening, if I do this test, right? And so depending on the screening test, there may be side effects. We said there may be. Everything you do in life, there may be a risk. But again, for example, if you go for the mammogram, you have to get it annually, but guess what? The risk of getting the exposure to the radiation is a risk. But is it a high risk enough for you not to get the mammogram? No. And sometimes when you go for that endoscopy or for that colonoscopy, it can lead to a little bleeding, but it's very rare. And so that is why, before you get these tests done, there's conversation, there's education that is being done with your healthcare provider before you go through that process, right? And so this was a case study. I know it's kind of a lot, but again, I'm not taking credit for it. It says here, Mr. Smith is a 56-year-old male with a history of high blood pressure, pre-diabetic, and obesity. He was diagnosed with diabetes 7 years ago when he presented with complaints of migraine headaches. At the time, in his office, his blood pressure was 163/90 on 3 occasions. Now, why is this important? It is important because when you go to the doctor's office, you or the clinic, the hospital, they took that blood pressure and it's elevated. That doesn't mean you have high blood pressure. What it means is that you could have had a white coat syndrome. Some people could have had a stressful day and then the blood pressure was elevated. So That's why we repeat blood pressure. So on 3 occasions, meaning that you went today, you went tomorrow, or the next day after, or we can do like 3 days apart, but the blood pressure, or even a week apart, the blood pressure remains elevated. That is significant. Mr. Smith was initially treated with lisinopril. However, he has since stopped taking his medication, as he believes that he can treat it with home remedies and by making changes with his diet. Many of us, when the doctor put us on blood pressure medication, was like, nah, I'm not feeling so good, I'm not taking it. And then you say, oh, I'm going to treat it with some herbal tea. Well, not knowing that there may be side effects with the herb, and now you're counteracting medication with herb. So we have to be extremely careful with that, right? And so it's important, especially in different cultures. They're used to, the Caribbean island, and a lot of people, they tend to have some, they say, oh, I'm going to take me a little garlic, I'm going to boil some sorsi, and then I'm going to be okay. But what's important here is that you did not discuss it with your physician or your healthcare provider. You didn't discuss it. You decided on your own. So it's important for us to really evaluate what is going on here with this patient, right? So he has a family history of diabetes and hypertension. His father passed away of a heart attack at the age of 65. Why is this important? When you have a family member with a history of heart disease, you need to get screened. Very important. That's again, why is it important for me to get screened? Mr. Smith has worked as a janitor at the same facility for 25 years. So he's worked hard, right? He has a wife and 4 children that he lives with. His wife is a house cleaner at the local hospital, and they both usually pick up an extra shift to support the family. Now we're looking at family dynamics. We're looking at additional stressors that impact the family health, right? So their eldest daughter will soon be off to college. So both Mr. and Mrs. Smith have been spending a lot of less time at home. Nowadays, dinner usually consists of any fast food along the way home. So Mr. Smith has not made aware of any progress with his diet. Because when you work 2 jobs, what do you do in between? You rush to just drive through to get something. So your nutrition isn't being impacted. On top of that, he has increasingly stressed as finances have been difficult with rent going up. For the past couple of months, he has been feeling pain in his chest while doing his rounds in the building. Recently, there has been getting worse. Although Mr. Smith is concerned, he did not have much time to visit his doctor since he's taking up a second job. You see what's happening here, folks? Well, guess what's happening? He is so consumed and so overwhelmed with his house duties, being the head of the household. He has 2 jobs, and he has not taken care of himself. On Monday, Mr. Smith felt a crushing pain on his chest. A crushing pain on his chest, right? So he decided to rest in between room, and as this usually helped his symptoms in the past. Well, today was different. The pain got worse, and Mr. Smith began to have trouble catching his breath. He grew scared and phoned for help. When paramedics arrived, they found Mr. Smith dozing in sweat. He dozed in sweat and nearly decomposed. Mr. Smith was rushed to the hospital, where he was informed that he was suffering from a myocardial infarction. You know what a myocardial infarction is? He got a heart attack. He was treated for his condition. However, the doctors warned Mr. Smith that if he continued this way, he may not be as lucky next time. Mr. Smith reminded in the hospital to be monitored. Although he was worried about the hospital bills, he knew that it was necessary to stay alive. Mr. Smith's doctor advised him that this could all be avoided with the proper precautions and health maintenance. He regrets not taking his health more seriously and feels that he has told his doctor about how he was feeling, he would not have been in this position today.
Wow, thank you,
So
You're going to summarize. Thank you.
So to summarize, and this is the last two slides, to summarize, where can you get screened? We know COVID-19 is important. You got the health department. You have here with the Keeping the Faith grant to fight COVID-19 sites where we go in a week and we provide the screening and the vaccine. You can go to Walgreens, CVS, I said CVC, I'm not sure what they meant by that, but any different curative location. And when it comes to cancers, you can go to the health department, your doctors, and get those tests done. And don't forget, Planned Parenthood, primary care physician does it for your STDs screen. Get your annual blood pressure check, as I mentioned. Consult with your primary care provider. And last but not least, I would be remiss if I did not remind you some of the steps to provide coronavirus. Wash your hands, social distancing, make sure you clean your countertops, cover your mouth, put your mask on, and make sure you get vaccinated.